Hi, folks. This is Abdul here, Dr. Mannan, GP in Haslingden, and also clinical director for Rosendale West. I just thought I'd do another video today just to bring you up to speed about where things are with recent news reports about Leicester going into partial lockdown. You probably followed the story on national media. I thought I'd bring some context to it and see how that may or may not relate to how things are locally. Now, as you know, the news reports you've heard are true. In Leicester, things are going to be managed a bit more strictly so as to contain the increasing numbers there. Now, it's important to realise that it's localised. It's not a national trend. Certainly not at the moment, folks. So I'm not talking about a second wave throughout the UK, and certainly no scaremongering going on. Let's be realistic about what's going on. Now, I suppose that lessons to be taken and continued and learnt perhaps is the fact that we need to maintain vigilance and we need to maintain our discipline. In an area like ours where we live, we need to make sure that rates do not go up. Now, as you know, some of us are more at risk than others. Even those of us who aren't at risk, there are things we can and we need to do so that we're not putting ourselves and our loved ones at risk. And these include the social distancing measures that the government has been pushing all along, which is that we do not get too close to people who don't live within our homes. So maintaining that 2 metre distance, and obviously in certain circumstances government are talking about 1 metre distance nowadays, but as much as you can make sure it's around about a 2 metre distance so that we're not spreading infection. Let's try and wear masks, for example, when we are visiting our doctors, hospitals, and even closed confined spaces like public transport. Perhaps when we go shopping, consider wearing a face cloth or a mask so that we're not spreading infection again. Similarly, hand hygiene in general, making sure that we wash our hands regularly and other methods to make sure we're not spreading infection in that way. Those of us who have been shielding or are at risk, are vulnerable for whatever reason, again, to maintain that and keeping an eye on that. But even though government is relaxing certain conditions, for example, having bubbles, family bubbles around the home so that close relatives could come and visit us, making sure that we stick to that. A bubble does not mean you have a bubble with one house 1 week and then another bubble with another house another week, because that doesn't really help the situation. You might as well not have a bubble. You either have a bubble or you have a mess, really, a more chance of risking infection. And I think that bodes true when we have within a family multiple homes. So, for example, mum and dad live in a home, and then son lives in one home, daughter lives in another home, the other son lives further away. And so you're not supposed to create a bubble around all those homes. You're supposed to perhaps create a bubble with one of the homes, perhaps somebody who's closer to you, who's able to support you more, and yet maintain the distance with other folks. With other folks, I suppose there's the other possibility, which is you can meet outdoors, anything up to 6 people. Again, maintaining distancing, you can meet people, your loved ones, outside in a park or perhaps in your garden. So if we could perhaps keep an eye on those recommendations. Now, the thing to note for there is that people are starting to meet. For example, we've heard about the rave parties. We've seen people going to beaches a lot. We're seeing people meet up in open spaces, but really they're just too close to one another. And examples are, for example, sporting activities, like a game of 5-a-side or 11-a-side, or perhaps playing cricket, or group sports, which brings people close together. Again, you have to question the merits of doing that really in a community situation. So again, be wary of these kind of activities. Um, there's folks in the community, some of us might be diabetic, we might have high blood pressure, we might have cancers, we might have various conditions. We may have health profile which includes like obesity, for example, lack of activity and so forth. I think it's important to take heed of those issues and make sure we kind of not necessarily isolate, but be even more vigilant and careful so we're not falling victim to spread of infection. I suppose in response, what I'm saying is keep ourselves healthy. Try and do at least half an hour exercise every day, even if that means exercising in the home. For those of us who can't get out of our chairs, we can exercise within our chair, within the confines of our living room or our bedroom. So, whether you can stay in or you can go out, it doesn't matter. You can still do exercise, some form of exercise on a daily basis. And there is good evidence that that helps prevent infections, keeps your immune system active. Besides that, eating healthy, of course, good food, all of that translates to good health. Good sleep, less stress, all of this contributes to good immune systems. Whilst I'm on about immune systems, it's important to also take note of how the role of vitamins, especially vitamin D. I have posted articles on websites before and on Facebook groups. There is good evidence that vitamin D helps to keep you healthy, boost your immune system. It doesn't directly prevent coronavirus, COVID-19. No, what it does, it helps keep you in good shape, just like good food would do, just like exercise would do, just like social distancing would do. It all kind of helps towards the cause of keeping you and I healthy so as to prevent contracting and suffering from any fatalities of COVID-19. I hope this was a good, useful reminder. Just a word of note on vitamin D. People ask me about doses, folks. Really, the dose is the recommended daily maintenance dose, which is is available. It's usually 400 international units a day for an adult. For those of us who are elderly or vulnerable, perhaps fall into categories such as, for example, BAME community members. There's public health guidance which talks about up to 4,000 units a day. So perhaps look at an increased dose of vitamin D on a daily basis. And this can be bought over the counter. For children, the doses are a lot lower. Some would say it's not even required for young children, but I suppose in the current environment where people have been indoors a lot more, it might be worth looking at like a multivitamin where there is a bit of vitamin D in there, and that should be good enough for young children. That's all I wanted to say, folks. Just stay healthy. Let's try not to see second waves in our locality. Let's not see much more fatality. Numbers are decreasing. Let's keep it that way. Do look after yourself. Stay safe and stay healthy. Thank you. Bye-bye.